Hi guys, it's Dr. Clark and Dr. Walton here with Fremont Spine and Wellness. And today we're going over how our posture really affects our overall health. So really a healthy posture, healthy spinal cord is essential to our overall health because of how our bodies, they have to work, right? So behind us, you can see this chart. So this is our brain, right? This is our spine, and our brain has to send information through our spinal cord out the nerves to all our vital organs and tissues. Each and every organ and tissue is completely dependent on the information, the energy that comes from the brain to keep us alive and healthy, right? Without our spinal cord, couldn't really get too much done.
That's right.
Right. So what can happen to us due to sitting at a computer, old injuries, weekend warrior activities, repetitive use, is that individual parts of our spine or even whole sections or curves of our spine can actually start to shift out of place. And when you get these shifts in your spine, this is referred to as a spinal subluxation. So these shifts, they really can start to have a big effect on our overall health because they're going to block the energy, the information that's trying to get through the spinal cord out the nerves to every organ, cell, tissue in our bodies. So what we're going to go over next is really the difference between when one part of our bone starts to shift and when a whole segment or curve starts to shift. So Dr. Walton's going to take that away.
Yeah, let me get this chart out of here.
Ta-da.
So like she said, spine really has two really important functions. One is it protects the spinal cord, and two, it keeps us upright and good posture, which is seen through our posture. So
yeah,
when we look at the spine, there's really different things that we look at. We look at the segments, individual, relative to the ones in below, and then we look at the whole regions of the spine, the neck, the mid back, the low back, in sections like that, and then obviously the spine as a whole. So one of the biggest things is really to understand the different types of subluxations, segmental and global. And when we talk about segmental subluxations, we talk about one bone fixated, that area, not moving the way that it's meant to. There's inflammation in that area, could be pain, things like that. And really, the whole purpose of adjustments is to help to get movement and motion back into those areas. And this is seen in our office, but also traditional chiropractic as well. And, one big thing that we focus on in our office outside of the segmental subluxation is the other piece here, which is the global subluxation, which as we see here, this would be an example of the neck. In the neck, there should be a big arc, a piece of a circle essentially. So we can see the bottom two bones pretty well in line. And then we see the upper and middle part of the neck there starting to reverse. So that whole section of the neck there is really not in its normal proper alignment. And one thing we really focus on is not only the segmental subluxations and getting movement, but also retraining and restoring proper global subluxations as well to really make it hold and like long-term effects and strength of the body to really set us up for a good, healthy, strong body for, as long as we want it for.
Definitely. Yeah. So segmental, just to recap, segmental is going to be the individual shifts in the spine. And this is something that, step one, as a chiropractor, we work on the segmental to get people out of pain and get them feeling better. But you have to look also at the global subluxations, those postural shifts. And really, when those start to be corrected in conjunction with the segmental, that's when we start to hear, better energy, posture improving, the hump on the upper part of the back going away. So it really is super important to look at both aspects because our spine is such a foundational aspect to our overall health and keeping us strong and healthy. So thanks for listening in. We hope you learned something there about the difference between different types of subluxations.
Yeah, thanks a lot, guys.